I'm here with Dr. Janice Tapper with Innovative Primary Care Family Practice. And there's a picture of you before and after, and that's pretty incredible. That was awesome. Now, was that really tough for you? Did you have to go to the gym? Did you fast?
Well,
Take pills or shots? How'd you do it?
well, definitely not any pills or shots. I'm not into that stuff. I prefer to do things naturally. So it was diet induced. The way I changed my eating habits is definitely the contributing factor, the most factor of me losing the weight. I went to the gym, I work out at home, but just keep in mind, folks, working out is only 20% of your weight loss. 80% of your weight loss is what you consume. And you have to consume, and I'm saying consume, but eat the proper nutrition in order for it to all work together synergistically. You have to eat a certain amount of calories, protein, healthy fats, and you do need carbs for energy, but try to be low carbs. So to answer your question, Mr. Tapper, I did change my habits, and it's working for me. I lost the 30 pounds. I've tried keto. That didn't work for me. I personally felt like keto is a dangerous diet. You eat a lot of fat, and keep in mind, when I talked about that metabolic syndrome, that fat is going right around your abdominal organs and covering causing visceral fat that leads to that metabolic syndrome. Again, I did lose 10 pounds with keto, but my cholesterol level bumped up. The 10 pounds that I lost, it showed up in my cholesterol panel. So that was unhealthy in itself. Intermittent fasting, yes, but don't expect to lose a lot of weight from that, because what you need to do is eat constantly every 2 to 3 hours throughout the day to keep your blood sugar levels consistent instead of the up and down and flip and flopping. I'm sure most of us experience when we eat, after you eat, I'm so sleepy. You're not getting enough of what you need to keep your blood sugar, because your blood sugar is jumping up and down all day. Eat every 2 to 3 hours consistently, and you'll feel a difference in your life. You'll lose weight, you'll have lots of energy, and you'll get a good night's sleep.
Dr. Tapper, that brings to question. You mentioned something, and I want to bring this out. Your practice, Innovative Primary Care Family Practice, is it your goal to get people off of medication or get them hooked on drugs?
Oh, definitely not. I am qualified to write prescriptions, but I prefer not to write prescriptions. If I can do anything to help someone reach their health goals naturally, that's my goal. And that's where I seek my benefits and my happiness in what I do. I want to keep a person healthy. So trying to stay away from prescriptions is more of what I do. And unfortunately, sometimes I meet people who come to my practice who are already at their wits' end and have had high blood pressure or diabetes for a long period of time, so they can't just suddenly stop medication. But if we change and modify your behavior, which is most commonly your eating habits, you can get off that medication. So it's don't say that I'm on this medication and that's it. You can get off the medication. If you've been on it a long time, it's just going to take a little time to wean you off.
So, if you had someone come into your practice and they have the metabolic syndrome, what would you recommend for them? Because I don't see many doctors' offices that have health coaches that work congruently with them. So, would you just advise them to see your health coach, turn them over to the health coach?
Yes, that will be in the plan of care for sure. Definitely have to get some numbers. So we would need to run a panel and get your cholesterol levels, see where your blood sugar has been running for the past 3 months. We call it a hemoglobin A1C. That tells us where your blood sugar has been for the last 3 months. And lipid panel, as I indicated, see how your high blood pressure is. And once we get the numbers, we'll know what we need to do for you so far as putting you in the weight loss program. And with 100% certainty, I would definitely include a health coach, because people will succeed more when they're with a health coach, when they utilize a health coach. And I use a health coach myself. It's just that motivation and extra kick that we need to stay committed to what we're doing to change our lives.
So, let's talk about that a little bit. Have you tried other programs to lose weight? That's all we have time for today. Please click that button and subscribe so that we can notify you the next time a video is released. I'm certified health coach Joseph Tapper. Thank you for watching, and we'll see you on the next video.